I am Dr. B C Rao, practicing family physician from Bangalore. See, actually we are in a kind of a major crossroads as far as the family medicine is concerned. 45 years ago, when I was in medical school and was getting out, the family medicine was the major branch of medicine which provided care to patients. And most family medicine doctors those days were very competent in providing primary health care. So, the patient generally went to these doctors first, and these doctors decided where the patient should go next, and they were competent enough to handle most of the problems at that level itself. That is because the training they got started from third year of medicine onwards, they were medical school, and because there were not many doctors those days, the training started very early and they became very competent physicians by the time they passed out and did their house agency, and most of them went into family medical practice. Over years what has happened, there is mushrooming of medical colleges, and most medical colleges with the exception of a few are poor quality control providers, and the doctors who are getting out of these institutions, first of all they are not competent enough to become family physicians. Secondly, they are influenced by the hospital based consultants. They are never exposed to good family physicians who also have postgraduate qualifications. This non-exposure is one of the main reasons why medical students are not opting to become family physicians. They want to become neurologists, neurophysicians, neurosurgeons, and there is glamour, and also there is money. These two attractions draw young graduates to specialties other than family medicine. The way to remedy this is to see that these young doctors are exposed to family medicine practitioners who have also done family medicine as a postgraduate qualification. What will happen is then they will realize the pleasure of being family medical practitioners, and also they will realize there is good, may not be the same kind of money as a neurosurgeon makes probably, but there is good money in being a family medical practitioner. And also the satisfaction and the pleasure and the happiness a family medicine practitioner gets, I do not think any other specialty will get. You see, as far as the primary medical care services are considered, we stand very poorly in the global scenario. Not that we do not have the infrastructure. The government in all its in its planning has provided an excellent setup of primary care centers, community care centers, and the district and taluka level hospitals. But then the problem is that the quality of personnel that man these services is abysmally poor. In the private sector too, the doctors who come out and practice family medicine at the primary care level, their quality is also poor, because these are doctors who are dropouts. They can't get into any other system or any specialty, and they take to family medicine. And how do you expect quality from them? And in India today, probably if you take account, there are more number of consultants than family physicians, more so in rural India. So, providers of health care delivery, in the real terms, we are way behind even countries like Sri Lanka, Thailand, Indonesia. They are far ahead of us in providing, even Bangladesh. We have to learn a lot from Bangladesh as primary care health care providers. As I said, you see, if you expose a young mind, let us say, to a family medicine department which is now lacking in medical colleges, he will see a family medical doctor practicing family medicine, and he will be spending time with him, and he will know what it means to be a family medical doctor, where he will see a child, he will see an adolescent, he will see a woman, he will see a middle-aged man, he will see an old man, and a spectrum of illnesses which spreads across all specialties. So he becomes, in the 3 years training he undergoes, competent enough to handle most illnesses at the intermediate level even. Only when it is really required, he will call in a consultant or a specialist, and that knowledge of when to call he will develop, and he will see the senior family physician with whom he is working enjoying really his life, and his patients are very happy. And he also sees a continuity of care which is lacking in specialty practices, which is really providing compartmentalized care to the patient, whereas a family physician provides comprehensive continuing care. There has already been some change, as I see. You see, as I told you, 45 years ago when I started practicing, things were much better from the point of view of quality of care, but from the point of earning money, India was a very poor country when I started practice, and even doctors, we were also not very wealthy, but we were a much happier lot compared to things that developed over years. Lately, in the last 3 to 5 years, I see a movement towards family medical practice, because there are few doctors who know that by being family physicians they can be happy. But a lot needs to be done by the way of starting family medicine departments in medical colleges. Independently, then what will happen? Large number of medical students will be exposed to family medical doctors. Similarly, what is going to happen at the governmental level? They should also encourage family medicine doctors to be placed in community health clinics, wherein there are 20 to 30 beds. They should not do as they are planning to do, to put a pediatrician, an obstetrician, a physician and a surgeon in that center. This is a wrong way of doing. They must put this man who is a qualified family physician in that center as a chief. Then what will happen is that this man will handle all the 4 departments, and you do not have to waste a surgeon's or time there. What is minor surgical procedures required, this man will do. Obstetric care, deliveries he will do, but when he is a difficult labor, he will recognize it early and he will call for help. So a comprehensive healthcare system can be provided if you get large number of family physicians to take up family medicine as a career prospect.